Well, hello, everybody. I am super excited to be here with Microbiome Keynote Events this afternoon to talk to you about gut health, and especially as it relates to a toxic world. I know you've heard some great speakers this morning, and I hope this is a continuation of an amazing day with some real practical tips. We're going to dive into environmental toxicity and the gut and how they connect, and how you can restore some of the function of the gut after these toxic insults. So let me get my slides up and we will jump right in. So I titled my talk, Keys to Restoring Gut Integrity in a Toxic World, because as you all know, I love to talk about environmental toxicity and especially mold-related illness. And both of these things have a massive impact on the gut microbiome and on the gut integrity. And there's no doubt that they are leading to increases in cancer, autoimmunity, even neurodegenerative diseases like Parkinson's, Alzheimer's, and other types of diseases. Autoimmune, especially, as we know, starts in the gut. And this is a place where we can make a massive impact when we choose to intervene. So hopefully today it'll be a little bit of an overview. If you've not heard a lot about biotoxin-related illness, it'll be a whirlwind tour of that. But I also hope to bring you some really practical guidelines and treatment tips so that you can take them into the office this week or next and have that practical application right away. So I always like to start with a fun story, and you may have heard me tell this before, but about 2 years ago, my writing coach, I'm working on my book right now, and he is a professional climber. And he said, one day we're working in the coffee shop, he said, "Hey, Jill, I'm going to go on a climb." Well, I'm always one up for an adventure. And so I said, "Sure, that sounds like a blast." And the funny thing is, I had never in my life been climbing. I mean, not even as so much as a rock climbing gym. So I had no clue. I just thought, well, this sounds like a fun adventure. And little did I know he would take me to the third Flatiron, which is an iconic peak of sandstone in Boulder, Colorado. It's what the Flatirons are named after, and my clinic, Flatiron Functional Medicine, is named after. So with a short 10-minute lesson at the bottom that should have been maybe a whole weekend course, I began my first climb. And this is looking down from the top where my guide was above me. And this was literally a 3.5-hour climb. I had no experience. But why I bring this up today is not only to show you that often when we go to those spaces where we're uncomfortable or where there's a lot of risk, those are the places of the greatest growth. They're also the places where we face our greatest fears. And this was absolutely one of those cases for me where I had to really face my fears. And one of the things I learned in this was so applicable to everyday life and adventures and challenges, and that staying present on that rock was critical, because if I would look down behind me, oh my goodness, that was pretty darn scary. You can see how small the trees are down below. And then if I looked too far ahead, it seemed overwhelming. So I had to stay very present, right, with the rock in front of me, just think about grips and my feet and where they were on the rock. And literally most of the time my foot was being holding my whole body weight by 1/8 of an inch type piece of rock. So this was quite a challenge. But when I got to the top, I felt literally euphoric in the sense of, oh my gosh, look what I just overcame. And it's really been a metaphor for my life. I have had cancer at 25, Crohn's disease a year later, and it's really flavored my whole passion for integrative medicine in the gut, because all of these things with enough willpower and functional medicine interventions can be overcome. And this was no different. This is just one more view of that look, on the rock coming up. And then this is to the side, the second Flatiron. I was on the third Flatiron, and this is kind of what it looked like from afar as far as the kind of climb that I did. It was quite an adventure. And then on the backside, once we got to the top, we sat up there for a few minutes and rested after 3.5 hours of climbing. And then I rappelled down on this rope to the bottom and then walked down to base camp. So it was quite an adventure. And it really just showed me, I love this quote by Stephen Kotler: to really achieve anything, you must be able to tolerate and enjoy taking risk. To make exceptional discoveries, you need risk. You're just never going to have a breakthrough without it. When risk is a challenge, fear becomes a compass, literally pointing people in the direction they need to go next. So what does that mean? That just means that sometimes that thing that we're most afraid of, I don't know what it is in your life right now, Sometimes that is actually the direction where we're supposed to go next, because conquering that next fear and overcoming adversity is the way that we grow and the way that we thrive and the way that we learn. Even in the immune system and the gut microbiome, when we have these challenges, often we become more resilient. And one of the things you'll hear me talk a lot about, if you ever hear me lecture on the gut, is diversity. And diversity is king. Diversity is one of the most important things for resilience. And if we apply that to our lives as well, that diversity of experiences and things that we've overcome, kind of catalog our history so that we can go and take things that we've learned from those experiences and go on and move forward and know that the next challenge that comes, we're going to have everything that we need to accomplish that. So I had no idea that I could climb, but I did it and I overcame, and you can do the same with whatever you're facing right now in your life. Okay, so today we're going to talk about toxic load. We're going to talk about how infections and toxins combine to create this landscape of chronic and complex illness that all of us are seeing. We're going to review lab testing and workup, and then we're going to discuss interventions not only for treating environmental biotoxin exposure, but also for restoring gut integrity. So why study environmental toxicity? So toxic exposures may cause a variety of symptoms, but often only after accumulation. And this concept of toxic load is so critical because it's really the underlying factor related to the toxic load and what accumulates in our bodies. And when we overwhelm our body's ability to detoxify, that's when we run into trouble. Symptoms could include fatigue, memory disturbances, sleep issues, headaches, or more serious categories that we're seeing increasing in, incidence, cancer, autoimmune conditions, and neurodegenerative diseases, especially Parkinson's, Alzheimer's, ALS, et cetera. Okay, just checking here real quick. We're going to go right back to slide deck. Okay. All right, so toxic load. So total toxic load, what is the total toxic load? The total toxic load is when we are all born with the capacity to detoxify. Our bodies are made to do this. And when our bodies overload that ability that we have to detox, it's almost like the bucket gets full and the water flows over the top. That's when we start to present with manifestations of symptoms or disease. So again, we all have the capacity to detox. It's innate in our systems. We'll talk a little bit about that and how we help aid the body in doing that. But in our toxic load, in our toxic world, with the accumulation of more and more exponentially toxins being dumped into our environment, more and more people are being overloaded. Their buckets are becoming full. The water is spilling over the top. And this is an analogy for the symptoms and signs of diseases that present. Like I said, especially cancer, autoimmunity, and we are seeing an epidemic of autoimmune disease now in our patients, especially post-COVID. The goal is to lower toxic load. So that water level, if we have a way to decrease toxic load, that water level will go down and we will see resolution of symptoms because we give the patient back margin. It's like when they have that margin back, they're then able to do what they're supposed to do. Now, the good news for you, if you're a clinician or a patient suffering or anyone listening at all, you don't have to know every last toxin in the bucket. That would be overwhelming and very depressing when we talk about toxic load, because we all get exposed every day to toxic chemicals and things in the environment. All we have to do is lower that margin enough so that we get back some room to breathe. We get back a little bit of space above the water, and our body will do what it needs to do. So lowering the total load is our goal, our end goal. And most of this presentation will be tips and tricks on doing that and restoring gut integrity so that we're not dumping a bigger load into the body. So this is just to remind you how full is your bucket. So what contributes to this total toxic load? Well, this is a really important slide because you have these exotoxins, the typical things that we think about, like heavy metals, VOCs, organophosphates, parabens, phthalates, et cetera, in our environment, heterocyclic amines, mold especially, and all of these things accumulate with exposure through our lungs that we breathe, the air that we breathe, the water that we drink, the food that we eat, and other things like coming in contact with the skin. But endotoxins are just as important, and this is why the gut immune interface and why this lecture in general on environmental and biotoxin illness is so relevant to the gut and gut health, because that endotoxin, which is internal from either bacterial overgrowth like endotoxemia from LPS, yeast or candida overgrowth, which we'll talk specifically about, other infectious diseases producing metabolic byproducts, even drugs, chemicals, stressors, et cetera. These are all internal endotoxins and they contribute to toxic load just as much. So when we restore gut integrity, we resolve the leaky gut, we are actually decreasing toxic load. So very, very important concept. So core principles of detox, just to remind us, every one of us is toxic. It just is what it is. We're all swimming in toxic soup. And exponential increase in environmental toxic approval of chemicals and things that are used on foods and waters, in our well water, in our land, are increasing each year. Recently in Denver, there was articles about PFOAs, which are like Teflon and the things they use in either non-stick ceramic or non-stick cookware, or some of the jackets and things that outdoorsmen wear. And these are forever chemicals. They stay into our environments forever. And the studies have been showing increase in blood pressure, increase in diabetes, and many, many risks. And these things don't go away. They are in our environment forever, which is kind of scary. So as we add to the environment, and even our water here in Denver was contaminated with those substances. So they were talking in the news about what a big deal it is and how should we find the companies. Well, finding the companies that did it, it's not going to really help the chemicals in the water. So total toxic burden we talked about, that's the bucket, the analogy of the load of toxins that we're exposed to and how this accumulation acts synergistically to cause dysfunction and disease. In genetically susceptible individuals, this dysfunction can lead to chronic illness. Especially those who are susceptible that can't detox as well. They have more accumulation and they have more trouble tagging those toxins and getting them out of the body. And your ability, all of our patients' ability to biotransform, basically take things from phase 1 to phase 2 and out through the bile and stool, is one of our rate limiting factors on toxic load and how the accumulation can cause illness in some people and not in others. And we'll talk about lifestyle, diet, and nutritional supplements that can enhance detoxification and help your patients heal from these exposures. So what contributes to total toxic burden? Well, our standard American diet absolutely causes part of the problem. So this is an absolute one of the things that we see as an issue. And exposure to heavy metals. Let's go back one here. There we go. Exposure to heavy metals like mercury, lead in your fillings or amalgams, petrochemicals, residues, pesticides, fertilizers in our food supply and in our runoff into our well water and water. Food allergies and environmental allergies also contribute. Molds and mycotoxins especially. We'll talk about that today. Medications, internal toxins we mentioned, hormone and metabolic toxins that aren't eliminated properly. And don't forget mental, emotional, and spiritual toxins like isolation, loneliness, anger, jealousy, and hostility. Really a big deal because in the last several years, especially in the beginning of the pandemic, there was a lot of social isolation, and it really is one of the most highest contributing factors to mortality and morbidity. And we weren't talking a lot about that during the pandemic because, of course, we were trying to do the right thing for spreading the virus, but we were also contributing to isolation and loneliness, especially in the elderly. So you can suspect environmental toxicity when you see these symptoms. And as you can see with this list, it is so common: joint pain, muscle aches and pains, fatigue, things with sinuses, postnasal drip, things with the gut, gas, bloating, constipation, diarrhea, difficulty concentrating, food cravings, skin problems, eczema, psoriasis, etc. All of these can be symptoms of environmental toxic overload, and you may want to suspect that if you see your patients complaining of these symptoms. I put this slide in because it's so important to think about the spectrum of vulnerability. What is that? Well, in typical toxicology, we talk about this threshold where most people, like 90% or more, are not affected by that load. There's always, though, these more sensitive individuals, like those on the left of that line of permitted exposure, that are harmed by very, very small amounts. And there's no average, right? There's no N of 1 in our real patient populations. And we, as functional and integrative practitioners, tend to see the more susceptible and sensitive individuals. And so often we're seeing those patients that are on the left that are harmed by a small exposure, even though the toxicology literature will say it's harmless or in those doses it's safe. The other thing we see with this is there are many endocrine disrupting chemicals that are hormetic in their effects, which means very, very tiny amounts. They almost have a biphasic curve where a typical toxicology amount will cause harm, but an incredibly tiny amount will cause a hormetic effect on the body and be just as damaging as those higher doses. And then we have to take into account the synergy. Often these chemicals combine, and they're worse when 2 or 3 or 4 of them are combined in their toxic spectrum of effect. So taking good history, just reminding us that we really want to ask about where they live, where they work, what they're doing, their habits, their hobbies, those kinds of things, their dental history, medical history, diet, because all of these things have to do with exposure. If they have, they're a pilot, they're going to get atmospheric radiation. If they're a dentist, they may get mercury or amalgam exposure in the process of filling cavities. So it's really important to know what your patient does and what they do in their free time. And then one of my favorite questions is, when did you last fill well? This kind of can target a timeline for them as far as often with, say, mold exposure. They maybe moved to a new house, and ever since that time, they've been feeling poorly, or all of their family got sick when they moved to a new location. So those questions about history and timeline can be incredibly helpful as well in targeting when things changed. You've heard this before, but genetics points the gun and environmental exposure pulls the trigger. About 85% of all chronic illnesses are lifestyle related, not just genetics. So yes, there's genetic components. Certainly my history with cancer and Crohn's has some of those, but a lot of times there's environmental inputs and they may have a bigger impact than genetics. So I like to describe the big problem as toxic load plus infectious burden. I always say functional medicine is quite simple. Most chronic inflammatory illnesses come down to toxic load and infectious burden. Which one of those is playing in? How much? Where do you start? But often it's toxins and infections that are combining to create inflammation, chronic illness, and chronic inflammation. So mold, let's talk about mold, one of my favorite topics. This is from a real inspection of my patient's house. You can see the meter that's checking moisture there is very high at 99.9% or 999 anyway, which regardless, it's showing moisture behind that wall. And you can see the bottom right corner, that is actually mold coming right through the wall behind that wall cavity where there was moisture leaking into that cavity. Now, it's not always this obvious. A lot of times the walls look perfectly clean and fine. And if you just ask your patient, do you have mold in your house? Most of them will say no, because they either don't know it or they don't see it, but they think that it's not a problem. So you really have to be crafty with how you ask your questions. You can ask, have your washer and dryer leaked? Is your fridge ever had a leak? Have you had any under sink leaks? Is there any signs of water damage on the wood under your sinks? Have you had any attic or crawl space issues that aren't sealed, or where there's been standing water? Has there been any intrusion during a storm in your windows? Is there condensation? And on and on and on. I could go on for many kinds of questions that you want to ask, but you want to really ask them the kinds of things that tell us if there's been intrusion of water or moisture into the home, because just that moisture intrusion in a porous surface like drywall or gypsum will often cause mold growth. And even if it's behind the wall or under the floorboards, it can be invisible and still be a massive issue, because these molds secrete mycotoxins. So what are the symptoms of being affected by mycotoxins? These are just some of them. Commonly fatigue, memory loss, word finding, brain fog, headaches, confusion, even seizures or loss of equilibrium, feeling spaced out. Often patients will have more joint or muscle pain, decreased libido, sores that won't heal, or dysfunctional immune system, heart palpitations, mood swings, personality changes, tremors, abdominal pain. Heartburn is common because of the mast cell and histamine effect. Numbness, tingling, nosebleeds, chronic sinusitis, sleep disturbances, incredibly common, insomnia or hypersomnia, painful lymph nodes, low-grade fever, not feeling well, and uncomfortable or frequent urination. And those are just a small fraction of all the symptoms. So in a mold or biotoxin-related illness, why is it important to find the problem? Well, one of the things we find, especially with mold, is avoidance is key. So mold avoidance is the first step, and no amount of binders or glutathione or IV phosphatidylcholine will overcome if the patient is continually being exposed. So you really need to find the source and either remediate, treat the source, or get the patient out of the environment temporarily. Whatever you need to do, the patient will typically not heal unless you get them out of that environment. So you can ask them, when did things start? When did exacerbation occur? How do you feel after exposure? Is anyone else in your household ill? So those are great questions to kind of pinpoint where the problem might be. I will tell you, for me, a lot of times the clue has been they go on vacation for 10 days or go out of state, or they go camping, or they do something away from their home, or they are away from work if the work is the culprit, and they feel better. Their symptoms go away. So if you hear that kind of story about the patient not being there and they start to get better, or they go on vacation, you can assume there may be something going on with their environment. So just want to give credit where credit's due. And there are some giants that shoulders we stand on, like Dr. Horowitz, Dr. Richie Shoemaker, Dr. Nabu with the cell danger response. And we're moving the needle forward. There's lots of people who've described this complex chronic milieu of infections and toxins, and I'm just carrying on with that. But I wanted to give them all credit because a lot of them have done extraordinary research and work and publications in this area. This was one of the original papers by Dr. Janet Hope about mechanism of illness. And it's not just an adaptive immune response, it's also an innate immune response. It includes inflammation, oxidative stress, toxicity, infection, allergy, and the irritant effect of exposure. This was a seminal paper by the GAO in 2008 and published the resolution of symptoms after treatment being part of the diagnosis, the response to therapy, and gave a two-tiered definition. So this is a great paper to be familiar with on indoor mold, especially if you ever have to testify or, talk about your patient's case in a legal situation. It's helpful to have these references. So what's the big deal about mycotoxins? I already told you a little bit about the kinds of things that they do to the body, the symptoms we listed. They're ionophoric, so they're very small. They can easily move in and out of cells. They're not easily detected in the blood. They're secreted by the liver into the bile, and they can often be reabsorbed like a merry-go-round, as the bile is highly efficient, and about 95% is reabsorbed in the gut. So unless you intervene with a binder or something to pull those toxins out, they often recirculate and cause collateral damage, and they become a vicious cycle, creating innate immune response in genetically susceptible individuals. So there are a portion of the population, about 25%, that have more trouble tagging these toxins, and they may have more trouble with detoxification. And so they get more sick in a mold exposure than maybe their family members or their coworkers. So there is a difference in the patient depending on their genetics and their susceptibility in how ill they might get in a moldy environment. And toxins can attach themselves to enzymes that involve insulin receptor, et cetera, and hormones, and they can cause so many problems. They can cause upregulation of the aromatase enzyme, so taking all your testosterone and making more estrogen, which in women can cause heavy bleeding, fibroids, endometriosis, painful periods, breast tenderness, fibrocystic breast, and in men can cause central weight gain, lack of muscle, decreased libido, and many other symptoms. So these are a big deal. They can also affect the ADH production and cause increased urination and dehydration. And they can cause weight gain. That's really a common one, where they tag onto the leptin receptors and cause a leptin resistance, where the patient has trouble losing weight. So this is just a diagram of how chemical exposure can cause genetic factors, barrier breakdown, which we'll talk about in the gut particularly, although this can be leaky brain, leaky gut, leaky mitochondria, and how these oxidative stresses form activation of T cells, macrophages, B cells, activation of innate immune system, production of pro-inflammatory cytokines, and inflammation and autoimmune. Now, this diagram was from Dr. Vojdani's work and was done well before the pandemic of COVID, but this exact same infectious exposure is happening with COVID and increasing pro-inflammatory cytokine production in some people and inflammation and autoimmunity post-COVID and long COVID. So this vicious cycle is when these foreign antigens or substances stay in the body and they cause the immune system to cause this fight or flight, this vicious cycle, and it creates collateral damage in the body. So it's the innate immune activation, the production of excess inflammation and cytokines, and it can cause autoimmunity or chronic inflammation or pain syndromes or fatigue, many types of symptoms. And it's multi-symptom, multi-system, which has been well described by both Dr. Horowitz, Dr. Shoemaker, Dr. Nabu, and many others. So what are some of the biotoxins that cause SEERS? Mold and other toxins in water-damaged buildings like Stachybotrys, Aspergillus, Penicillium, Chaetomium, etc. Toxins associated with tick-borne microbes like Borrelia and maybe even the co-infections with Babesia, Bartonella, Anaplasma, and Ehrlichia. And we are having epidemic levels of tick-borne infections. And it's a real issue because if the immune system is robust and strong, able to keep those old viruses and infections at bay, it's really not a big deal. However, nowadays, the immune systems are becoming more weak because of toxic exposure. And these things that should have a very low virulence, like Epstein-Barr and tick-borne infections like Borrelia, become a big issue because the immune system is not able to keep them in check. Cyanobacter from freshwater blue-green algae and marine dinoflagellates that produce Cingulata are also sources of biotoxin-related culprits. And usually we see this in a water damaged building. So there's really a toxic soup in a water damaged building. And we like to talk about this versus just mold and mycotoxins because there's many other things that can cause damage to the body or cause illness like actinomyces or fungal and candida species or beta glucans, et cetera. And all of these things in a water damaged building can cause illness, not just mold and mycotoxins. So let's talk about the two arms of the immune system. In traditional medical training, we talked about acquired immunity and the allergic response to mold. That was well covered. Mold as an allergen, which is true and absolutely can still happen. But there is another part of the immune system that activates with mold that we haven't talked about or learned about much in medical school, at least traditional allopathic, although now it's becoming a very popular topic of conversation. If you look anywhere on social media or environmental toxicology, you're going to start to see this more and more. But the innate immune system is that arm of the immune system that produces cytokines, causes autoimmunity, and these biotoxins can cause severe disruption in that cytokine production and also in the HPA axis. So you have all kinds of hormonal dysregulation, hormones, adrenals, thyroid, weight gain, et cetera. And like I said before, there's a small percentage of the population, actually fairly large, 25%, that doesn't clear these toxins easily. And we can test innate immune markers in the blood to see if they're activated. It's not diagnostic. There's a lot of disagreement among physicians if they test these or not. I still do because I want to know what's happening with the immune system. And those would be things like VEGF, MMP9, TGF-beta, ADH, osmolality, and others. So this is a personal picture and story for both acquired and innate immunity. You can see my face there. It looks like I just got a massive rash or hives on my face. So what I did is I went and did some microneedling on my face. They poke little tiny holes in your skin to increase collagen production. And I thought, well, that sounds fun. And then I put the serum on that they told me would be great. And I didn't look at the label, which was my problem, first problem there. And it turns out it has both yeast and soy, which I'm very allergic to. So basically I did a skin prick test like you would at your allergist on my face. And it was pretty inflamed and ugly for about 10 days. So that's what that looks like when you have acquired immunity. It's basically under the dermis, those mast cells get activated, they create a hive-like inflammation. And in my case, I did it to my own self on my face, and that's what it looks like. Innate immunity is this chronic inflammation that's on a different level, on cytokine level, that can cause disruption of capillary barriers, it can cause gut disruption of barriers, and can cause increased permeability on so many levels. And I put this photo here because the first photo on the left is 5 or 6 years ago when I was really ill from mold illness. And then the one on the right is about 2 years ago since I recovered. And you can see even the shape of my face, the puffiness of my chin, my forehead, my eyes are all different. And that's a visual to show you what an innate immune system can do when there's inflammation and chronic inflammation and things like permeability, where there's, more puffiness or edema. And I did go through mold-related illness about 6 years ago after the Boulder floods, and my office flooded. We had a crawl space that had standing water just under my office space. I had the contractor had put new bamboo flooring over old carpet, which terrible idea right now in hindsight. So every time I was stepping on that bamboo flooring, I was puffing up old gross carpet, probably mold and mycotoxins. And also the floor below me had standing water. And then the basement 2 floors below had growing live, lots of Stachybotrys. So I learned firsthand. I got very, very sick from that. I had to leave that office. And the great thing about it, though, is this quote from Edith Eger, one of my favorite authors. She's a Holocaust survivor. And if you haven't read The Choice, great book, great read. Our painful experiences aren't a liability, they're a gift. They give us perspective and meaning and an opportunity to find our unique purpose and strength. And that is the story of my life, because I had aggressive breast cancer at 25 years old during medical school. I fought my way through that and survived through 3-drug chemotherapy, radiation, everything, and really destroyed my gut. So no surprise, about 6 months after I finished treatment, I developed Crohn's disease. And unbeknownst to me, I also had silent celiac disease. And when I changed my diet and restored the gut microbiome over several years' time, my Crohn's is gone. My cancer is gone now, almost 20 years later. So that's my story. And that's how I have become one of the experts in gut function and functional medicine in general, because I've lived a lot of this myself and had to figure out how to recover my own health from that. So testing environment, this is important in the sense that we are not the environmental experts typically as physicians, but we have to know just enough to advise our patients. And certainly I recommend a professional inspector, but in some areas that can be difficult. Nowadays, you can find virtual inspectors. And if you need resources or recommendations, you can go to the nonprofit ICI.org. That's ISEAI for International Society for Environmentally Acquired Illness.org. And they have IEPs, indoor air professionals, and doctors who are trained in biotoxin illness. And you can go there. But I often do have patients do a qPCR test, formerly known as ERMI. ERMI's not very well validated in how it derives its numbers, so I don't like to use that terminology, because if you're talking to an inspector, they'll be like, oh, that's not valid. But qPCR, the type of testing that's done with a dust sample and DNA species of mold, is valid, and it's a great way to sample the environment historically of what molds might have been there. So I frequently have patients do a qPCR or ERMI test and send me the results so I can look at those and see if I see any suspicious species. For example, if I see like 10 of Stachybotrys spores or Chaetomium, I'm pretty concerned that there's an issue in that environment, because those are particularly nasty molds. Again, just to remind us, mycotoxins can cause adverse and powerful toxic effects. They're cancer-causing, hepatotoxic, immunotoxic, dermatotoxic, teratogenic, neurotoxic, estrogenic, hemorrhagic, nephrotoxic to the kidneys, and mutagenic. So all of these things from the toxins that mold secretes. And those are invisible. They're volatile organic compounds that go right through the walls into the air that we breathe. And even if we don't see the mold, or even after remediation, if the mold is broken into 1,000 bits or the mycotoxins stay around in porous materials in our homes, we can still be ill unless it's cleaned up. So let's start to move from the mycotoxins, biotoxin illness to the gut. I love talking about this study because it was done in some children in Africa that had contaminated grains. So they had already been exposed, and they were studying the effects of that exposure on their gut. And they hypothesized that particularly trichocythenes, which are typically from Stachybotrys and some of the more toxic molds, may play an important role in the etiology of various chronic inflammatory intestinal things, such as inflammatory bowel disease. So I think this is very relevant. And because, again, we see biotoxins and toxins in our environment cause very significant permeability and damage, not only to our brains and our mitochondria and our skin, but also our gut. In this study, there was 3 toxin exposures, aflatoxins, fumicins, and the deoxyvaliolinol, which is a trichocythene, and they showed that it may induce what they called environmental enteropathy. I love that, because that just means a damage to the gut lining that's caused by the environment. And this is actually more common than you would think. It caused mild malabsorptive syndrome that manifests with villus atrophy. Now, what else do you know that causes villus atrophy? Well, celiac disease and giardia. So villus atrophy is just the damage to the villi, like the shag carpet that line the gut. They get denuded and you have hardwood floors. You lose absorptive surface. And this caused crypt hyperplasia, T-cell infiltration, and general inflammation. So it was absolutely significant, very similar to what celiac disease or parasitic infections like giardia would cause. And you can see these biopsies from the gut lining. On the left, there is after mold exposure, the villi were denuded and ruined, just like in celiac disease. And on the right side, that would be the normal villi. So from these studies, they took some key interventions, and here's where the practical application comes in, because you can use these in your clinical practice. I frequently talk about them for biotoxin-related gut damage or just leaky gut in general, celiac, giardia, Crohn's, colitis, that these would all benefit from these nutrients. And these are zinc, vitamin D to A in a 1:5 ratio, spore probiotics like Megaspore and HU58. I'll tell you a little story. About 20 years ago when I had Crohn's disease, I did not know a lot about probiotics. I was in allopathic medical school, learning a little bit of functional medicine, but certainly not an expert at that time. And I remember I did not tolerate probiotics. In hindsight, it was because I had both fungal and bacterial overgrowth in my small bowel, and I was already fermenting, and I did not do well with some of those fermenters like lactobacillus when I took them orally. But what I did find was there's this one Bacillus subtilis that I did really well with. I didn't even know at the time it was a spore. I had no idea back then, but I knew there was something different about that. This is one of the reasons I am so, I love to talk about spores. I love to talk about products from Megaspore and Mega Probiotics and HU58, because I personally 20 years ago felt like that was a big part of what healed me from my Crohn's disease. And again, I didn't even know about spores back then. I just knew they worked. They did something different than the traditional probiotics in my gut. So I'm a living example of that. Mega mucosa or mega IgG, any bovine immunoglobulins are going to help with both passive immunity and starting to heal that permeability. And L-glutamine powder can also be used. But I feel like as far as powerhouses, the spores and the immunoglobulins are a 1-2 punch. I often use this post COVID as well with gut damage or gut integrity issues because it's so powerful. But these things are critical in that healing of the gut. Okay, so let's briefly shift to how to work up the toxic patient. Just a couple slides, and then we'll shift into treatment options for your patients. So toxic patient, first of all, we can't talk about mold without addressing terrain. And this goes back to my theory on toxic exposure and infectious burden being the combination that creates inflammation and many of the diseases we're seeing. So as you have environmental toxic load increasing, you overwhelm immune system, and then you get these old infections, Epstein-Barr, CMV, HSV, Lyme, Borrelia, Bartonella, Babesia, Ehrlichia, you get the picture. And these things start to pop up and cause issues. So it's not just the immune system, it's not just the infections, it's that interplay of infections and toxicity that create the issue. And again, fungal and viral infections should be very low virulence, but they come about and become more of an issue when the immune system is in a weakened state. So as we get more toxic exposures, weakening immunity and causing more issues with our patients, then these fungus and bacteria and viruses become opportunistic and can cause serious illness. So the toxic load plus infectious burden creates systemic overwhelm and inflammation. So I will not read through all of these, but you can keep this slide as a reference. This is kind of the workup I do for almost any new patient, sometimes even more than this, but this is the basics, all of your basic metabolic profiles, your full thyroid hormone adrenal profile, homocysteine, iron levels, because iron can be very inflammatory in someone who has 1 copy or 2 of the gene for hemochromatosis. You want to check vitamin 25 hydroxyvitamin D, 125 active calcitriol, lipid peroxides for oxidative stress, any of the vitamins that you can measure easily. There are also panels. You can do micronutrient panels, specific toxicants based on history. I typically do urine testing for that. We used to have a lot more options, but some of the panels that we used to use are not available. So right now I typically use a urine panel for that. And as you well know, we'll be doing an afternoon Q&A live, and I will be there this afternoon and answering your questions. If you have specific questions about labs or types of labs or anything like that, I will be there to answer your questions. I also do an ANA and extra ENA panel and metals, hair, serum, and urine. Typically, I'm checking blood levels, but sometimes I do a chelated urine challenge. RBC fatty acids, stool analysis, organic acids, amino acids, glucose, insulin, A1C, adiponectin, leptin, this workup for celiac, which is TTG, IgA, deaminated gliadin, IgA, and IgG. And then total immunoglobulins can really be helpful to find immune deficiency syndromes. So I always check those as well. Or if you have a severe elevation in IgE, you might suspect mast cell issues. And then Sears Lab specific for mold and biotoxin and urinary mycotoxins. So that's a lot. And that's not even counting the infectious workup. But this will give you a good idea of what kind of inflammatory components, how the immune system is functioning, the hormones, and all of that. So it's a great place to start. Here is the urinary mycotoxin testing that's available. We have real-time labs, we have GPL, Great Plains, and we have Vibrant. And they each have their strengths and weaknesses. Again, I can tell you personally what I like to use. They are all good tests, but some I think give us different data. The Real-Time uses ELISA technology, and the Vibrant uses immunochip. So that's the spectrum of sensitivity and specificity. So you can pick up more on the Vibrant, but you also may get some false positives. Real-Time Labs, you're probably going to get real positives, but you might miss some. So you have pros and cons of every company, and they're all excellent choices. Okay, so let's switch to treatment and end the last half hour or so with some options for treatment for your patients. So I start with limbic retraining. You're like, oh my goodness, why are we starting there? That's because with mold, we've seen that the chemical sense of inhalation goes right into the hypothalamic pituitary axis into the brain. And there are studies that show it activates a limbic response just from the chemical exposure. And so I've always known that there's this connection between trauma and limbic activation in mold. But until recently, as I was researching for my book, I didn't realize that it's literally in the literature as a chemical trigger to the amygdala and to the hypothalamic pituitary axis and to this limbic upregulation or limbic response. So part of the first thing you want to do is give patients some options on limbic retraining. I always say it's kind of like a smorgasbord or a buffet. You can pick and choose. Some things are better, like reading books. Some people might want to do a program online or reading a book. Other people might want to do a more passive therapy, like binaural beats, which is a type of music that calms the system, or craniosacral therapy, or integrative manual physical therapy, or neurofeedback, or breath work. So there's a lot of things that I listed them all here, and many more than even are on this list. But you want to give your patients some options to kind of calm down that limbic system overactivation. And after limbic activation, you want to address the mast cells. So the mast cells are these cells that are kind of primordial immune cells that often get activated by mold or toxins. And they can be a big deal because if they're overactive, you can't implement very many treatments because the patient's so reactive to things. So this is just a list of some of the basic treatment options and how to treat. I love quercetin and Chinese skullcap as some natural options. And there are medications as well. And you often need to combine and layer these. And again, in the Q&A, if you have specific questions on mast cell, I will go deep into it. Here's a resource. I have a free YouTube channel with tons of great interviews with other people who are smarter than me. This one is with Beth O'Hara. So if you want to hear a great interview on mast cell activation, some of the things you can do, go check out that interview on the YouTube channel, also on iTunes, anywhere you listen to podcasting, you can find these episodes. And especially this one is really good with her tips and tricks for mast cell activation. This is an article I wrote about mast cell activation. And again, because it's more than I can cover in this presentation, if you want more information or a step-by-step guide to treat and even diagnose, this is an excellent article. You can also look at the consensus statement by Dr. Lawrence Afrin and Tanya Dempsey, two brilliant clinicians. I actually have a practice and they work together, and they and several other authors have written second consensus on mast cell activation, diagnosis and treatment. And it's a great paper where you can actually learn and read more about this if you need to go deeper. And I will be sure and get that link to the organizers of the conference in case you want to check that out, but you can search it and it's free and available online. Avoiding high histamine foods can be a big issue with patients with mast cell activation because you're adding to that load of histamine. So fermented products, anything where there's a protein that's broken down, so leftovers, bone broth, fermented things. And these are good foods for the microbiome, right? So it's always surprising to people like, oh my gosh, those are all the really good foods for the gut microbiome. Yes. And if you have histamine intolerance, like I did for years, these things will cause rashes or hives or heartburn or stomach upset. So when patients first are diagnosed with mast cell activation, often they have to be more careful with these high histamine foods, even things like vinegar or ketchup and mustard or relish, all the stuff we put on barbecue hot dogs and stuff, that can be an issue. And really all kinds of artificial dyes and preservatives. So they will often be more reactive to things and additives in food as well. Okay, so one of the things that is not always talked about in mold-related and biotoxin illness is fungal colonization. This is a really big deal. And if you're missing it, you're missing a lot of patients who are really sick. Now, not everyone who has mold and biotoxin illness is fungally colonized or even has mold internally. There's a couple different things. First of all, let's talk about mold. Mold has the spores. The spores are large. They're tested in air quality testing or dishes or things where they grow the mold in an environment to see if it's there. But often if the mold is treated or remediated and it's dead and there's just debris from the dead mold, it's almost as if you had a dried flower arrangement. You flicked it with your finger or you blew it with your, like a candle, and it would just scatter everywhere in these millions of particles. So dead, dried out old mold, even if it's not living, those particulate, those fragments can still cause immune activation. This is why often after remediation, the patient remains ill and they don't get better because they are still getting exposed to the fragments that are left over from the remediation. So one of the key points that people miss all the time is after remediation, small particulate clean and usually fogging is critical to get that patient back into that environment. So the order of operations is typically remediate the mold, cut away all kinds of porous surfaces 2 feet or more away from the border of where the mold was affecting it, and then cleaning the HVAC system in the house, and then fogging with a dry fog or fat soluble material that kind of brings all that material down to surfaces, and then small particulate clean, which is wiping down all surfaces in the environment and getting rid of any porous materials that might have been contaminated. And that you may have a successful remediation, but often patients who are sensitized will not do well if there's not a clean after the remediation. Okay, so back to fungal colonization. This is something we often miss. We must have a high index of suspicion, and common risk factors are frequent or antibiotics as children or frequent courses of antibiotics, diabetes, history of steroid treatment for other things, inflammation, autoimmunity, asthma, etc., pregnancy or hormone replacement, general debility or extremes of ages, high stress, immune suppression, and Addison's disease, also alcoholism. These are all common precursors of fungal colonization. So what are symptoms of candida? Fatigue, poor memory, brain fog, gas and bloating, sugar or carb cravings, white coating on the tongue. I often, even on Zoom, ask patients to stick out their tongue and let me see that to see if they have a white coating. Rectal itching can be a symptom, insomnia or hypersomnia, anxiety, mood swings, muscle pains, alcohol intolerance, because the metabolic byproduct of yeast is acetaldehyde, and that chemical is the same thing produced by alcohol when the liver detoxifies it and what causes a hangover. So if you look at this list, it's actually very similar to a hangover, because that same chemical after alcohol induction or alcohol consumption, acetaldehyde, is present when you have yeast colonization. Skin rashes, especially around the eyes, and acne are common as well. So it feeds on sugar and carbs, so a lower carb diet is helpful when you're treating. Dysbiosis and antibiotic overuse provide opportunities for infection and colonization. The hyphae from the yeast can burrow into the intestinal lining and increase permeability and also food sensitivity. So these are big deals. Contributes to excess cytokine production and inflammation, contributes to food allergies and leaky gut, and damage to the intestinal lining. So this is one of those things underneath, along with environmental toxicity from biotoxins, that causes more permeability and more toxic load, because the endotoxins from the gut lumen are getting dumped into the bloodstream. So it's an internal job, but it's still a toxic load. Super common with biotoxin illness because weakened immune system. And yeast, if you think about it, it's opportunistic. So yeast takes advantage of a weakened system. Diagnosis includes stool culture, urinary organic acids, and immune labs like IgG, IgA, IgM. And any one of these can be a clue. Sometimes you won't get any of these and there'll still be a significant fungal colonization. So just because you have a negative stool culture does not mean they don't have significant fungal dysbiosis in the small bowel, in the sinuses, or other areas of the body. Treatment. This is an overview, and then I've got some real specifics. You can use fluconazole or Sporanox. You can use nystatin. I love nystatin because it's non-absorbable, so you can use it even in young children. Very, very safe, and you can use it for long-term if needed for suppression. There's no absorption of nystatin, so it treats the gut without going systemic. Fluconazole, itraconazole do go systemic. They go through the liver. You want to use caution if there's Addison's or adrenal failure, because itraconazole can induce an Addison-like syndrome. So very, very a big deal. You can lower the cortisol. If they already have low cortisol, they won't feel well on itraconazole. Compounded oral amphotericin B can be used in cases of resistant. I don't use a lot of it, but it is also not absorbed when it's compounded orally. And then there's many herbs, undelicate acid, caprylic acid, garlic, berberine, oregano, powder argo, olive leaf. You can use combinations or single herbs. Usually I find combinations to be the most effective. So Mega Mycobalance is a phenomenal product for this. It has undelicate acid, which is one of my favorite antifungals, and B propolis. And undolicleic acid is a fatty acid derived from castor bean oil. It inhibits biofilm formations. You can kind of bust up those biofilms, and then it's more effective when you do something else like propolis or caprylic acid or other things. And this is actually far more effective than plain old caprylic acid. So I love this as a mainstay for antifungal treatment. And then B propolis is a natural antifungal, antibacterial. It contains flavonoids. You do want to use caution if there's a clotting disorder because it can increase thickness of blood viscosity just slightly. And it's also effective against the fluconazole resistant strains. So this kind of gives you that 1-2 punch, inhibition of biofilms, and then B propolis to break down the cell walls and the hyphae. And it showed in studies that it definitely inhibits growth in vitro on the bottom right. And then it pairs well with Restore Flora. Restore Flora is that combination of spore probiotics plus Saccharomyces boulardii. Saccharomyces boulardii is a healthy yeast that can colonize, crowd out the bad yeast. The one caveat or caution with Saccharomyces boulardii is you can check inflammatory bowel markers like anti-Saccharomyces antibodies. And if they do have those antibodies positive, they probably will react to Saccharomyces boulardii, even though it's Saccharomyces cerevisiae that's causing the issue. So in those few subset of patients, if you check them and find they have anti-Saccharomyces antibodies, that would be my contraindication to using Saccharomyces boulardii. And in that case, like in my case with Crohn's, I used plain old Saccharomyces, I used plain old Bacillus subtilis, just a spore probiotic, no Saccharomyces. It also pairs well with this mega IgG or any sort of bovine immune globulin, the mega mucosa, the mega IgG capsules or powder. Huge, huge fan of bovine immune globulins. They are so powerful in their passive immune assistance. They can passively bind to viruses, to H. pylori, to C. diff toxin, and incredibly powerful to help you with other pathogens in the gut, and especially Candida as well. Antifungal diet can be important. I'm not a huge fan of being super restrictive. I do usually restrict sugars and refined carbohydrates because you're just fighting a losing battle if you throw those in and they're still eating a lot of sugar. But it does help to eliminate or decrease carbs and alcohol. This is a study on the IL-17 mediated immunity in response to opportunistic Candida, and showed that there was increase in IL-6 and antimicrobial peptides that acted. This was just interesting. In a mice study, they fed them either coconut oil rich diet or soybean oil or beef tallow, and the colonization of yeast or Candida was less in those that were fed coconut oil versus beef or soybean, just showing that coconut oil and monolaurin and caprylic acid, all derivatives from that coconut, have a good anti-Candida effect. But as you saw before, the undoliceic acid has a much more powerful effect than even caprylic acid. Okay, so let's shift one more time and time to detox and move on to detoxification principles. So I always talk about some really simple things, and it's clean air, clean water, clean food. If we go back to the basics, we often get a lot of traction and a lot of improvement on the symptoms by just decreasing the inputs that are toxic. So clean air, we want to have HEPA filters in our home, in our airplace, regularly replacing air. And you can move your filters if they're standalone around so they get more area of the room. Most of us don't have a hospital grade filtration system in our homes, but those air filtration standalones like Austin Air, like IQ Air, like Air Doctor can be very powerful ways. In my condo here, I have 3 large air filters. In my office, I have 5. So I have very clean air in those spaces that I live and work in. You can also replace your furnace filter with a high MERV rating. 13 and above is ideal, but sometimes the thickness won't fit depending on your furnace. So you got to use the one that fits best and is the highest MERV rating. Clean water, recommend filtered and spring water. Clean food, organic, pesticide-free, chemical-free, local if possible, and GMO, non-GMO. And then identifying most common off-gassing sources in your home. New carpet, cabinets, and wood flooring can all off-gas formaldehyde. And new furniture, upholstery can do the same, some of the flame retardants. And you want to rule out mold exposure because that's a big deal in your indoor environment. This is just my Austin Air in my office. I have these all over the place and I love them. I'm a huge fan. These are home air quality meters you can buy on Amazon and test your air. The PM is particulate matter 2.5. That's the stuff that goes right into your lungs, diffuses into the alveoli. And like for us here in Colorado, after the wildfires, there was a very high level of particulate matter 2.5 in our air. And it caused some of the same lab dysregularities and inflammation that mold would just from being in the outdoor air. HO is formaldehyde, and then the total VOCs is the other thing it measures. Now, if your carpet's off-gassing VOCs, it could look high, even if it's not mold, but mold, volatile organic mycotoxins can also raise VOC level. And you can measure this in your home with one of these home meters. I think the professional ones are a little bit higher quality, probably more accurate, but those cost a lot more. So basic principles of detox, just to remind us, we need optimizing elimination excretion through hydration, sweating, and bowel function. This can include lymphatic things we'll talk about later. Optimizing gut microbiome, we'll talk a lot about that. Supporting mitochondrial function, and then optimizing the liver, phase 1, phase 2, and the detox pathways. Here's just a reminder of phase 1, phase 2. Phase 1, you need these cytochrome enhancers, things like B2, B3, B6, B12, all the B vitamins, folic acid, glutathione. And then we have phase 2, which is related to sulforaphane and glucuronidation, sulfation, and all the nutrients there are listed as well. So you really need to support both phases. If you support just phase 1, like for example, coffee supports cytocrines in phase 1, there is a good benefit to coffee. But if you're pushing phase 1 at the expense of getting stuck in this intermediate and not enhancing phase 2, you're often left with these intermediates that are more toxic than the original toxin, and patients get pretty sick if you push that toxic pathway and you push phase 1. Phase 2, I think, is harder to support. You need good foods, leafy greens, you need folic acid, you need methionine, and you need glutathione and sulfation. And so it's, I think, a little harder to support all of these things. And this whole pathway also requires NAD for more ATP production. And we know from studies that ATP is depleted by mold and mycotoxins, and so is NAD. So I find that those are critical factors as well. But if you have someone who's really poor detoxifier, incredibly toxic, and you push methylation, like folic acid, B12, et cetera, or you push NAD in that pathway, you can often make them worse because you're enhancing the detoxification more quickly than they can eliminate. So let's talk a little bit about that. So we have this basically mobilization of toxins, which you do when you mobilize the biotoxin biotransformation pathways, and you have excretion. That would be your pathways like your gut, your stool, your skin, your sweating, your breathing, your lungs, any pathway, your kidneys and your urine. Those would be excretion pathways. I think it's really easy to mobilize. You can give glutathione, you can give things like liver support, where you can do sauna. And these things mobilize toxins out of the tissues into the bloodstream where they can be filtered out and excreted. But usually the problem when someone has a Herxheimer or die-off reaction, or they don't do well with detox, is their mobilization is going okay and they're not excreting. So that's really one of those things you want to remember. If you have patients who aren't doing well, you need to support excretion, which is usually more difficult. Things like dry brushing, lymphatic drainage, and your pathways with urine, breathing, sweating, and eliminating through the stool are all critical. This is just a list. Again, I won't read through this, but just so you have some of my favorite detox elements, some of the key things that are in the biotransformation pathway. I don't always use all of these, but these are kind of on my list of things that are critical for detox. In the very basic, I use glutathione or precursors to glutathione like NAC, milk thistle, lipoic acid, selenium, etc. Even vitamin C, glycine, and glutamine can be precursors of glutathione if the patient can't tolerate glutathione. And then binders. Binders are real critical because as the phase 1 and phase 2 excrete the toxins into the bile in a water-soluble form, that bile is reabsorbed very efficiently, about 95% in the enterohepatic circulation. So in order to break that up and pull it out, you need a binder with a charge like clay, charcoal, zeolite, glycomannans, et cetera, that will actually pull those toxins out through the stool. Okay, speaking of stool, let's talk lastly about phase 3 in the gut. Gut microbiome is phase 3, which is basically because that gallbladder stores the toxins, excretes it in small quantities into the gut lumen. And like I said, if you're not using binders, it gets reabsorbed. And so it just recycles like a merry-go-round. And in those patients we talked about with the genetic susceptibility that don't tag those antigens, they just reabsorb and cause a vicious cycle of innate immune inflammation. So adding in those binders and things that will bind and pull them out through the stool is really critical. The gut actually microbiome has some ability to conjugate some of these. So it's critical that we have a diverse and healthy microbiome, and that's part of the detox. And if you don't have a healthy microbiome that's changing those in form, for example, if you have if you have poor glucuronidation, you can use some calcium D-glucarate to enhance that. And beta-glucuronidase in the stool, if it's really high, can indicate that's an issue. Then you won't be conjugating estrogens and certain toxins that need to be conjugated in order to be eliminated. So supporting detox phase through the gut, of course, elimination diet, taking out things like soy and corn and wheat and eggs and dairy and sugar and alcohol, super important for some of our patients, actually most of them. I would say the majority of my patients are off gluten, dairy, and sugar, and then some of them are off the rest of the things. For me, Crohn's and cancer 20 years ago, I went off soy, corn, grains, gluten, dairy, sugar, alcohol, and I've been off for 20 years and I couldn't be happier. So you don't have to add those back in, but you do want to support the diversity of the gut microbiome. Coffee enemas, I'll show you a little bit about that in a moment and tell you why it's so important, but we talked about that elimination and excretion after detoxification. When we mobilize those toxins and we excrete, coffee enemas can enhance glutathione production in the liver through that enterohepatic circulation and through the rectal mucosa. So that's really important in some patients. Stool bulking agents and fibers, there's a list of those there. Spore probiotics, huge fan. HU58 and Megaspore are my favorites. Mega Omega, so this is an anti-inflammatory fish oil that contains SBMs and resolvins and pro-mediators. There is so much literature. These things basically bypass EPA, DHA, and at the very bottom, if you're converting, you can make SPMs, and SPMs are incredibly powerful anti-inflammatory. I'm going to show you a couple slides that tell you why that happens. And then cholagogue herbs are things like dandelion and gentian and absinthe that cause secretion of bile and cause excretion of more of the digestive juices. So those can be incredibly helpful as well. A lot of these things, I went to Switzerland for a liver detox retreat in 2018 and 2019, took a group of people. And one of the things they did, the German doctors, coffee enemas, cholagogue herbs, those were a key part of their detox. And I realized how powerful those two interventions were. And we don't always talk a lot about that in the US. So I throw this in because if you want to know more about the SPMs, the RONTASE pathway, the platelet activation that can happen post-COVID, I did a great lecture with the brilliant Bob Miller, and you can see his pathways and hopefully understand some more of this stuff and why the SPMs are so critical even in long COVID. This is just a sample. You can download this on his website, nutrigenomicresearch.com, I believe is the website. But if you can see at the top right in the center here, this omega-3 pathway, this FAD, if these genes are mutated, you're not going to be converting EPA to DHA. And down here in the green, kind of right in the center of the chart, is protectins and resolvins. Those are in Mega Omega. These are SPMs. I'm a huge fan post-COVID. And you can see here how they cause decrease in platelet activation in the clotting cascade. So huge fan for pain, for inflammation, for post-Lyme treatment syndrome, for post-long COVID. A lot of these inflammatory conditions do really well on SPMs, and they are in Mega Omega. So you can get both the fish oil and those SPMs in that one product. I take it myself. I'm a huge fan. Here is the recommendation I have for coffee enema. Years ago when I first, like in the US, all they had was, you brew the coffee, you cool it down, you filter it, you hang the bag. It's just like this big old process. And I thought, that's overwhelming. I'm never going to do that. And I went to Switzerland and they had these kits, and these kits have a BPA-free bottle with this German organic clean coffee with charcoal that's instant. So you put a teaspoon of that charcoal in charcoal coffee mixture in the bottle, you fill it up with warm tap water, you shake it up. That's it. You attach the tube, you squeeze into the rectum, you hold it, you expel, and you're done. One of the easiest things ever, makes the coffee enemas something super easy for patients to do. So we actually import these from Switzerland because there's nothing like it in the US. If you want to know more, the website down below is where you can get them. Okay, lastly, lymphatic support, regular gentle exercise, castor oil packs can be huge. Hydrotherapy, that hot and cold showers or the cold plunge pools and things. Lymphatic drainage remedies like iTires and gosh, there's all kinds of them out there that are helpful. Lymphatic massage, dry brushing, rebounding, and then herbs that are lymphatically supportive like red clover, calendula, burdock, echinacea, rhubarb, and astragalus. And that would be key if you're having mobilization without excretion and the patients are getting stuck. Lymphatics can be really critical in that case. Okay, and I think I'm just about at time. So last thing, just want to leave a little cute picture of my dog, Ravi. He takes Phytospore. He's a huge fan and he loves Megaspore. So he gets that in his food every day. And he's like 96-year-old in human years. He's 17 years old and just in great shape, still running around. He does have a stroller for long walks, but he loves this Phytospore. And I'm such a fan. I love that that you've made dog products as well. Okay, so lastly, just to end this presentation, I'll be back for Q&A in an hour or so. But I know it can feel like pushing and pulling. These can be complex chronic patients, but hopefully some of the tools and tricks and things that we presented today can be helpful. And like I said, I'll be back for Q&A. A few resources for you I want to leave you with, and then I will let you go. I do have a free YouTube channel. It's just stuff, free information with great, smart, brilliant people, smarter than me. And you can go just to YouTube, find my name and find these interviews. If you or someone you know knows a great person to interview, let me know because I'm always looking for guests on the podcast. This is also broadcast audio on iTunes or anywhere you listen to podcasts, all free. So please subscribe and check out the content. And then if you want to get my professional newsletter, any of you who already do, I just send out free, great information, blogs, weekly blogs and content. It's all free, but you can text DRJILL to 66866 if you want to be signed up for my free newsletter. And again, just all free content, resources to help you be a better practitioner. Here's how to get in touch with me. And thank you so much for your time today. I have really enjoyed talking with you and look forward to the Q&A later today.